Good evening, good afternoon, and good morning. This is the 1744th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Indraneel Bawatekar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, and you can, whether it be a homeopathic lover or a homeopathic student or a homeopathic doctor, it doesn't matter. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Dr. Indraneel Bawatekar, and has completed MD in homeopathy and has a multiple degree, that is LLB professional, and MD, DMJFM, PG diploma in forensic medicine. And he is known to be a homeopathic nephrologist, practicing in Narayan, Perth and Pune, and has more than 31 years of clinical experiences. His subject of interest is to explain medical laws to doctors in simple words. He has taken more than 50 CMEs to doctors and students, and last time presented a brilliant session on nephrology, and has presented another session in English on the importance of knowing laws by doctors. So today, Doctor will be discussing about dementia and its homeopathic management. We proudly welcome guest of the day, Dr. Indraneel Bawatekar. Thank you, sir.
Yeah. Sir, am I audible to all?
Yes, yes, audible.
Okay. I'll just share my screen. Yeah, just a minute.
Yes.
Yeah. Sir, can my screen be viewed to all? Is it
Yes, yes,
comfortable?
yes. Yes, and now you can make it large, enlarge.
Okay.
Okay.
I can enlarge it. Okay. Is it visible, sir?
Yes, everything fine, everything.
Everything fine. Very good. Yeah. Thank you, sir. Firstly, I would like to thank our senior members, Dr. M.K. Sahani, sir, our daily attendant, Dr. Ram Shah, sir, also Dr. Dhanesh, sir, Manoj, sir. Before session, Madam Kakkar was there, senior, or Srimati, Madam John is there, and everyone in the IFPH. I will be very thankful to all of you for giving me this opportunity to present in front of you. So, friends, today I will be talking on the subject of dementia. This subject, basically speaking, is very common. Just yeah, everyone in our family, we have seen that as they grow old, they start forgetting words. Suppose if you give a 70, 80 years old grandfather a watch, he will look at the watch, he will see there, he'll keep somewhere and again forget it. After some time, he will again ask us, where is my this thing that shows the time, this thing that I kept here. And they cannot utter exact words, they forget everything. So collection of symptoms is called as dementia. We all are going to age one day, there is no remedy for it, and we are also going to have dementia. So friends, today we will see what is dementia in short, and what is a homeopathic approach in the management. Okay. So friends, dementia, it is not a specific disease, but a general term for the decline in the cognitive functions severe enough to interfere with our daily life. What are the cognitive functions? Like recalling small things, walking, eating our food, taking bath, even you can say taking medications. And if a person develops dementia, all these things are affected in day-to-day life, and chances of mistakes are there. which result into increasing their old age problems. So while aging, the risk of dementia usually increases because as the age advances, the dementia also advances. Now, what is dementia? This will come to our mind. Dementia encompasses a range of symptoms that are affecting the memory of a person, like thinking and also the social abilities of a person. Alzheimer disease is the commonest cause. We see somebody suffering from Alzheimer. In old age, there are only two things, either Alzheimer or dementia. Actually, Alzheimer is a part of dementia only. But other types of dementias are also there. For example, there is vascular dementia because of the blood vessels getting affected of the brain, Lewy body dementia, and frontotemporal lobe dementia. Brain diseases also contribute for dementia, like Hutchinson disease is there. There are many, you name, and the list of these given in our medicine book. But these are the very common thing. Now, what is the prevalence of dementia in India? These figures will definitely tell us something how it is going to increase. So all over the nation, approximately 7.4% of Indians who are aged 60 years and above, we call them as senior citizens, and they are living with dementia. They're equating to about 8.8 million individuals. The number is rising day by day, or we can say week by week, not day by day, week by week, we can say. In India, it is projected that the population suffering from dementia in 2050 will be up to 20%. So just seeing that today we are around 140 CR population in India, almost 1/5 population will be suffering from this dementia, even though the aging and the life expectancy has increased because of the advanced technology in medical science as well as with the medications. But to live with dementia is a punishment. Almost 1/5 our old age people will be suffering from dementia. Now, what are the types of dementia? Books have mentioned 10, 15 types. We will consider which are common and which we see in day-to-day life. Alzheimer disease dementia. There all the cognitive functions also get affected, and mostly it manifests in tremors. Frontotemporal dementia. So all the matter which is in the temporal region and the frontal region of the brain, it gets affected, and all the functions which are physiological books mention, they get affected in this dementia. Lewy body dementia. This dementia is very common in India. We will be talking about it, and also vascular dementia. That means the dementia which is because of the affection of the blood vessels of the brain. Now, I will just have a few words about the Lewy body dementia. It has been observed that these are the pictures of a neuron in a brain. Alpha and beta synuclein proteins are the different types of proteins. They get slowly deposited in the neurons, and the brain gets affected, and even the function of the neuron decreases. All the functions from sensory to motor decrease very lately, but it goes on decreasing, and this abnormal deposition is called as Lewy body dementia. My homeopathic management will be at the last, but I will give a clue for this. In 2 to 3 cases, I myself have verified to, we can say, wash off this protein deposition. I myself have made use of our mother tincture Cretigus, which Dr. Boric mentions that it dissolves the calcareous deposits in the heart. But my experience shows even in brain also it is very helpful. So it will be a good tip for you. You can try it for some days, and there is no harm for using the mother tincture. What are the symptoms of the Lewy body dementia? Symptoms, they vary from person to person, from male to female. Normally, the symptoms which are seen because of the deposition of the abnormal protein inside the neuron, there is memory loss. People, they cannot recall their names. Sometimes first it begins with their relative names, the distant relatives' names, and there is weakness of the memory. Sometimes there is behavioral changes. The behavioral changes, we see that our old age people suddenly sometimes get nervous. Evening time is the more, I don't know why they're aggravated in the evening. It has got probably some physiological relationship. And they become nervous, they sit aside, they start becoming isolating themselves, and they have behavioral changes. When you ask like a simple thing, probably they may in a large voice react to you. Even thinking is a problem. If you ask them for any small thing, they get confused. I have seen confusion means where are the keys kept. Now, can you give me the keys, car keys? They will not be able to recollect it. Can you give me the my checkbook? If you ask them to your grandparents, they will not be able to recollect. अरे मैंने यहाँ रखा था, वहाँ रखा था. So this thinking problem is also seen in Lewy body dementia. Sleep disturbances. Sometimes there is no sleep for late night without any cause, and patients become addicted to sleeping pills. Sometimes the sleep is disturbed. They just toss about in agony. The sleep is there, but it is disturbed. And sometimes they get their sleep completed very fast at 2 a.m., 3 a.m. Probably in Maharashtra, I have seen that morning walk, senior citizens are more seen because their sleep gets probably completed very fast. These are the aging changes. Mood changes we have seen. Movement changes. Their movements slowly they become slow because they have got fear of falling, and even if their muscle strength also goes on reducing, and all the things they do very slow like a robot. These are the common symptoms in we are discussing because in India, Lewy body dementia is seen in many people. Now, in general, we will say what are the causes of dementia. Dementia is a very vague diagnosis. All the neurological disorders, any disorder of the brain, any we can say, will cause a neurological disorder. Infections like HIV is there, encephalitis is there. Now HIV is little bit less common, but it is there. Acute infections like encephalitis is there. I had seen a patient of Cysteria sulci. The people who eat meat, the nematodes and the cystodes, they get deposited in the brain and they cause early dementia. Vascular disorders. People now diabetes, blood pressure, cholesterol is very common after the age of 40, and prolonged having these diseases for long many years causes atherosclerosis of the cerebral vessels, and there is a deposition of the atherosclerosis in the brain vessels leading to vascular dementia. Advancing age. There is no figure for advancing age. I have seen a 80 years man fit running here and there, and a 60 years old man walking in dusty. So this is not advancing age by calendar, but we can say his physical and biological age. Genetics is very common because in genes also many people, if their mother, parents, grandfathers are having dementia early, we are going to suffer from dementia early. Some brain injuries, head injuries, roadside accidents may cause brain tumors like the gliomas. Then we can see the malignancies also of the brain can lead to it. Kidney, liver, lung disease, all the organ disease can cause early dementia. Poisoning is a little bit rare, but it can lead to it. Hypoxia and dehydration. Usually, people who climb up, they have hypoxia. Those who are trekkers, and probably I am saying, hypoxia may bring them dementia in early age. Age is a risk factor, which I told you. It is significantly after the age of 65 years. But I have seen even a 40 years person suffering from early signs of dementia. Family history, I told you. Lifestyle disorders like smoking, malnourishment, less protein diet, protein allergy, malnutrition, lack of exercise, they all contribute for early dementia. Health conditions such as we already discussed, blood pressure, diabetes, cholesterol, they are linked with high risk. Now, the symptoms usually we see in our old age people, there is a short-term memory loss. Short-term memory loss in what sense? I will tell you. Suppose I'm delivering a lecture, I'm talking to you. Suppose I'm more than 70 years of age. People start forgetting, what I was talking? Okay, we'll start from there. So that is a short-term memory loss. So this usually is seen in our old age people at the beginning. Difficulty in finding the words. Like I told you, okay, what is the difficulty? They suppose if you give a watch, they may probably find it difficult to say this is a watch. They will say this is a thing which shows us the time. Daily I see it, night time I get up and see it, but they cannot recall it as a watch. This can also be seen. So these are all cognitive declines, we can say. Then the challenges while problem solving. Suppose they meet with any problem, very simple. In a roadside accident, if something happens to them, they get like disturbed. Then they become like a child. They cry also. They may run here and there also. So they cannot solve the problem, but they start behaving like childish way. Mood and personality changes we already discussed. Many times we old age people probably they get mood changes. Sometimes without any reason they are into tears, and sometimes they are in a good mood. But tears in old age is not due to mood all the time. In my last 32 years, I have seen there is weakness of the lacrimal glands in old age, and probably the tears they get automatically coming down. We feel that the old age persons in our family are in tears. They are not happy, but probably it is not true all the time. It is due to aging process also. The tears can be there. Now, diagnosis of dementia. How should we diagnose dementia? Probably, there should be a yardstick to measure how much dementia is there and what numeric figures are there. But there are no numeric figures available for diagnosis. We have to go on the clinical score of the decline of the cognitive functions. Usually, the diagnosis of dementia, it involves medical history, means the past history, present history, physical examination. If somebody is having tandem walking, somebody is having a rigidity of their muscles, somebody is slow in their movements, and also the cognitive assessments. These are clinical things. So, like during our case taking, when we were clinically examining the patients, these things will help us in diagnosing the patient. Early diagnosing, it is very crucial for management and planning. So early diagnosis should be done so that we will help these patients, and even ourselves when we are going to age above 60 years, we can help in solving this problem. Now advanced where investigations, they include CT and MRI. CT and MRI shows, like you can see, the left hand side there is a normal brain tissue, and at the right side it is shown as severe. So this is shrinkage of the cerebral cortex. As there is a aging, the all cerebral cortex, it starts shrinking down. Means from career side, I would like to relate an example. Suppose we have a coconut at our home, and after a long time, if you break it, we see that the coconut has shrinked inside, and we get a round coconut inside. The same thing happens with our brain. Shrinks down, and because of the shrinking, the shrink part, the outside matter where the cortex is there, all the functions which the different areas do, they start declining, and we say that it is a cognitive decline for this patient. Yes. So their patients may experience the same thing, like memory weakness, reasoning they cannot give proper. Sometimes, in their daily activities also, they may get difficulties while doing daily activities, climbing stairs, catching auto. Many things they may face, and everyone faces a different problem. What are the effects on day-to-day life? We saw the problems. Now, effects are also important. Sometimes I have seen my grandparents making, problems in the money matters. For our laborers, they used to pay them monthly salary twice because they used to forget, yeah, have I given the salary or no? Sometimes the payments when the laborers used to get, they used to get less amount than decided because they could not counting problems. If you give them a money of 100 notes, sometimes they will calculate 98, some will calculate 90, again they will recalculate 102. So these problems also I have seen. These are the effects of this dementia. Medicines forgetting. Those who are on daily medications, many a times they forget because at the same time, at the same interval, people take medicines for BP, sugar, after lunch, after dinner. And as they advance, they forget today I have taken or no. Yesterday I have taken, I remember. And sometimes they take double doses and land up into health problems. So these things can occur. Important documents which are placed in the house sometimes are unable to recall them where they have kept. They keep us telling us, I have brought them, I have kept here, it was here only, where did it go? So this is all declining functions. Sometimes if you point out their mistake, they become irritable like anything because nobody likes to point out his mistakes. No human being likes to point out his mistakes. And slowly, this all things they result into non-socializing. Slowly, the people they start because of the dementia, they prefer to remain at home. They will only watch TV. They will not mix in people because they have fear in mind that they will be either criticized or they will be laughed at. So people, unfortunately, they become unsocialized and again land up into psychological problems. If they fall sometimes, they may also face fractures and hospitalization may be there. At the below slide, you must have seen that the man is walking and the old man is following him. You can see near his step, there is a doormat. But because of dementia, a old age person may think that it is not a this thing like a doormat. It is something, no tiles on the floor, and he will try to jump from it. So these problems can also occur because of the aging. So these they get misleaded because of the shadows, we can say. This can be also the effect in day-to-day life. Now, what the management we will see. Management is very important because we have to manage such cases. Why should we manage? Because they hamper our day-to-day life. But friends, keep in mind, medications can help to manage the symptoms, but there is no cure for dementia. Nobody should claim that they cure dementia. So in the management, we should tell the patients and the relatives that the symptoms, the complaints, they will come down a little bit. They will get a relief in this, but total cure is not possible because there is no medicine available in the world which will reverse the effects of aging on us. We are going to have the same effects of aging on us. See, there should be done lifestyle interventions. So if you are walking in the room, if there are some obstacles, they should be removed and the road should be clear. Physical activity at home should be done. PT exercises, sitting on a cot should be advised. Then healthy diet, who are vegetarian, non-vegetarians can have it. Mental stimulations and social engagements. Social means mixing in people. Now, prevention and management. Like I told you, for simplicity, that is means to reduce the clusters in the room. Just we had a talk. Ensure that the rooms are having lights, and it is lights are put on in all the rooms. Usually, old age people think that the light will be more, and they put on the lights in the room where they sit. Okay, so the light should be put on, and there should be a good vision everywhere. It gives a positive energy also. The rooms of the old age people, I request them to label the rooms. Suppose room number 1, they have their all medical files over here, insurance file over here, their health records over here. Room number 2, suppose I ask them the bank documents over here, they should label these things in the rooms. They help a lot for these patients in the management. So this helps them to get confidence and also helps in non-occupying their mind. Exactly. Then establishing a routine and a structure. What routine? A routine in breakfast, lunch, dinner. If they set up a routine at certain intervals at a time, same about sleep, it helps a lot for these patients to easily complete this task. They should also lead in our school days. We used to read, paragraphs our teachers used to give, and we used to read poems. In the same way, I request them to speak clearly and slowly and in short sentences when communicated to us. Also, daily they can in their bedrooms they can read a paragraph which will help them in improving their cognitive functions. Physical activity should be promoted, but do take care that this should not land up into accidents and fractures. Now we'll go to the homeopathic part. Now this is important for us. We had a revision about dementia. Now homeopathic part, the commonly used remedies. I'm not saying the remedies are only these remedies. There are many remedies, but these are commonly used remedies. Lycopodium clavatum is there. It is used for memory problems and confusions. Those old age people who suffer from this. Anacardium, suggested for memory loss and indecisiveness, where a patient cannot take a decision. Short-term memory loss is there. We can think of anacardium. Barata carbonicum, considered for mental weaknesses and forgetfulness. Of course, not a single line symptom. The entire drug picture or the portrait of the disease should match for the Barata. Otherwise, it will partially act and not have a desirable action. Natrum mur is a polycrest, constitutional, acute, has been widely used by all of us. It is also a very helpful remedy. In electrolyte imbalance, sodium plays a major role in our brain tissue. So natrum muriaticum frequently is indicated in dementia patients. It is used for concentration difficulties and mental fatigues. But see that you should always consult a qualified homeopath and also decide the remedy according to his guidance. Even though I usually tell senior homeopaths, my teachers also, sir, even your homeopaths, I respect you, but always with your brother practitioner, have a word and then take the medicines. Do not self-medicate with you. Now, in the homeopathic management, how should we manage these patients? Probably we will, as a psychological part, I know everyone will find a rubric dementia in our repertory, the indicated remedies, and try to match the drug picture. But friends, this does not work all the time. So we have to diagnose according to different types, and then we should apply homeopathic medicines to have effective results. Suppose you want to diagnose the dementia, whether this dementia is because of the brain hemorrhage, because of the brain stroke, and has it come as a sequelae of these two problems should be kept in mind. Because after these two problems, we have different medicines in our repertory and also materia medica. If there is a cerebral atrophy, if there is a ischemia, the homeopathic medicines are different. They cannot be blindly given as dementia medicines. Alcoholism. This is very important. Homeopathy interferes with this patient homeopathic medicine. So we should ask the patient in homeopathic manage to withdraw alcoholism or to stop them. Also, you should diagnose that this dementia is because of alcoholism. This is very important. Homeopathic diagnosis. Lewy body disease of the brain, which already we had already talked before. Tumors and pathologicals, we have seen that any tumor malignant or maybe non-malignant, we have different remedies for that. So like this dementia should not be blindly treated. Every dementia patient should have a MRI done. He has to be diagnosed properly, and our prescription should be with support of this pathological diagnosis. That is very important. Now, remedy to be decided upon. Suppose there is a hemorrhage in the brain, then we have remedies like in case of acute hemorrhage, blood pressure patients, they acutely have bleeding in the brain. And they have dysarthria, dyspraxia, and dysphagia. This we have seen in our medicine books. For them, we can give belladonna, natrum sulfuricum, arnica medicines. Some patients come to us post paralysis where they cannot talk, when they cannot express, where they cannot think. Also, they have ability, no, they are not able to finally walk in proper position. For such patients, we should give Barata carbonicum, causticum. We all know it's for single-sided paralysis, and conam maculatum, where there is an ascending paralysis. So our homeopathic diagnosis should be based on this. Then and then only we are going to get good results. Now we have seen renal failure patients are increasing day by day. I've got many patients in my practice have renal failure. By bad luck, somebody has dialysis and it is forever. In such patients, I have seen there is something called as dialysis dementia. Friends, you must have also witnessed this. But are there any homeopathic remedies? Yeah, they are there. For such patients, we can use Varicata carbonicum, zincum, califos, and for the weakness, we can use phosphoric acid, so or acid phos. So we have a rubric directly as dialysis dementia in our synthesis repertory. So emotional changes, if you are see, you have seen in patients, like cares about business. In our mind, for a normal homeopath, we only have one drug, that is Bryonia alpha. Anything related with business, I have seen that we are tempted to give Bryonia, but it is not all the time same. In synthesis repertory, they have given in emotional changes cares about business, who takes care of the business, not failure. Lilium tea is a remedy. When there is sadness, especially in the evening, and especially like during music hearing, we see in old age people, we can think of Tarantula. If there is alternating state like sadness with excitement, carbonicum sulf can be a remedy. So, like these approaches should be kept in mind. Every patient should not be repertorized with common symptoms like forgetfulness, words cannot express, aphasia, and these all will misguide us, and there are traps which will guide us to a wrong direction. So, friends, we should take an approach in this way: that what is the clinical diagnosis and are our remedies pathologically matching to them? Now, there is one more approach that is called as miasmatic approach. Every case is a different case, friends, of dementia. So these approaches have to be applied as per the case. You have to apply a soric miasmatic approach where we can see a patient of cerebral atrophy. There is a gross ischemia, specifically of the cortex. In such patients, we can think of soramiasm, and we can select a medicine that is soric in origin. Syphilitic medicines can be selected where there is sudden brain hemorrhage, where there is an infarct of this brain. We see that many MRIs can show us infarct of some areas. Cerebral atrophy is there. So in such patients, syphilitic medicines, anti-syphilitic, they work more well, because for them, if you give a soric medicine, they will partially act. So miasmatic approach is also important. Psychotic, we have seen edema of the brain after injury, dilated ventricles, I mean the lateral ventricle of the brain, tumors like gliomas, malignancies, and hard calcium deposits. In such patients, we can think of psychotic medicines. So this is one of the thought of miasmatic approach we should keep in mind. Now, some cases are to be decided by properly taking the case and evaluating the case. In an acute case, if there are acute symptoms which are presented, then if the recent changes have been seen, like irritability is there, involuntary laughing is there, crying is there, or acceptability is there, we have to take a proper case and decide that this is an acute remedy. never administer any constitutional remedy, it is hardly going to work because constitution takes a long time to work. In chronic cases, some people sometimes give acute remedy. But chronic case where there is persisting and increasing symptoms, like we can say there is forgetfulness, which is gradually increasing. Months and years, people are forgetting things. While walking, there is a tandem walking. They get balance, problem is there. Usually, these patients complain of vertigo, and which is never better with any medications because of dementia induced vertigo. Inability to recall, suppose like names, street names, their places of their friends' houses. Sometimes patient may develop phobias, phobia while crossing the road, phobia while going on the height, phobia while traveling in an aeroplane. They may develop. So we have to, take remedies in such a way that what they have developed, is it an acute case, it is a chronic case, and according to the remedies we should administer. That is very important. Now, friends, directly we can think that we get rubric of dementia. We can take the physical journals, we can take the thermals, and we can proceed with the dementia case. It is not simple all the time. Different repertories have given us different rubrics as per the symptoms. In a short duration of time, I will just explain them to you. In a complete repertory mind section, suppose we can see that the patient is having lack of confidence and also with memory loss, then the remedy is given as anacardium. We can think of this remedy considering only these two symptoms. Suppose if there is financial loss and there is a ailments or aggravation of the old complaints after financial loss, after post-COVID, we saw in many patients. 80% of homeopaths were tempted to give Bryony alba, business failure, ailment form. I don't disagree, but sometimes it will work, it will not work. But if we go through complete repertory, we can see there are remedies like absinthe, acrid tea, agatha A, and calcarea ers. We have to compare the materia medica and then we have to decide that because of financial loss where the patient has suffered, which remedy has to be given. Suppose a patient comes to us with a memory is they're active and active for only names, for proper names, but they forget all the old things. But for names they can recall, some names they cannot recall. Suppose the memory is active only in short duration, we can think of asarum, eupatorium, germanium, hydraulic acid, and uranium urs. These are the remedies. So I'm just introducing you short remedies in the complete repertory, which we should consider for dementia patients. Now there is one more repertory that is called as acute repertory. I don't know whether everyone has it. I'm using the Synergy software where I have an acute remedy in that, acute repertory in that. This is for all acute complaints for any conditions. So it acutely tells us, suppose a normal patient, he suddenly becomes abusive, then we can think of arnica, belladonna, causticum, and all these remedies. Suppose a patient in acute state, old age, like grandmother or grandfather, they have start with disposition to contradict us. We say anything and they will contradict. This is a new observation in the family. Then we can think of camphora, cantharis, causticum. These remedies are also working very well. Even hipar, cantharis is usually used in only urinary, but it can be thought of in mind complaints. A mind inconsolable, who cannot be consoled by anything, they never get convinced. For these also acute repertory mentions like spongia they have given, aconite, sulfur, veratrum, different remedies are given. And also excitement, they have given aconite, antimtar, apis. When they get excited acutely, any patient, which was normal before, you can refer these rubrics and also think for these remedies. Boric, as mentioned, because it is a clinical repertory, Boric has given the word dementia. Every repertory doesn't give the word dementia, very limited repertories give. So in that you can say because of old age, if you have mind dementia senile, that is old age, we have anacardium, aurum iode, barata acetic, and all the remedies. Syphilitic dementia. Some few minutes ago, we discussed about the miasmatic approach in dementia. Suppose it is a syphilitic dementia where there are infracts in the brain, then we can think of aurum iodum, kali iodum, and mercury, all the remaining remedies. If there is a fits or epilepsy, then we can think because of the acute hemorrhage in the brain, belladonna semicifica we can think of. Boger has given us in mind section, Boger's synoptic, yeah, the back side of the Boger's synoptic, the small book. Discontented, if the patient is discontented, then you can think of these four remedies. If the patient has a impulse to escape all the time, he is lying down and he has an impulse to escape, he has to all the time go somewhere, you can think of bryonia, belladonna, cuprum, maxomica, opium. If he behaves childishly, you can think of anacardium, baratakar, belladonna, pufo. So this is a Boger key, synoptic key gives us this advantage. Very limited remedies, no list of remedies. Pathak report is there. If the patient becomes abusive, he starts scolding somebody, quarrelsome without any cause, you can think of conium, because conium we thought only in glandular affections, ascending paralysis, but we can think in mind symptoms also. If somebody is abusive, scolding, this is a very funny rubric. If suppose a female patient is there and she becomes abusive, quarrelsome with the husband only, then you can think of Tuja. If somebody like with Tuja, you can think of psychotic miasm. Somebody is only abusive and scolding and quarrelsome, you can think of Aurum, you can think of Chamomile and Dalkamara. Pathak gives you a very short remedies for this. Now, friends, after the conclusion of homeopathic approach, in few minutes, I will just go through only one case and I'll keep some 5-7 minutes for your question and answers. I will definitely like to answer them. Now we'll take an acute case, because in chronic cases, we have ample of time. Everyone is going to take a good case, all are good homeopaths, I know. But in acute cases, sometimes our decisions keep on changing. We have to take the decision on the present scenario. So I'll be just telling you an acute case. Because of medical legal issues, we cannot show the photographs of patients, one thing, and without their consent. Secondly, there is no yardstick to show the improvement. We have to clinically assess the patient. Now I will tell you, there was a 78 years old patient having diabetes, blood pressure, and was on anticoagulants and was brought to the OPD in last week. This is the case of the last week. Now, what were the complaints? The relative said from afternoon he has started to become very angry suddenly. He's throwing things and using abusive words, this grandfather, without any cause. He was apparently all right before. Also, they told that he's forgetting to say the right words for a water. They will say, I want to have some drink. He cannot say water. Even his son's name he could not recall. He just said, like, small son, now he has grown big. He used to make actions. Suddenly he started with this symptom. And also they told in the history that from last 2 to 3 months, he was having difficulty to recall the recent events and also to recalling the day-to-day activities also. That began 2 3 months back. Now before his complaint, like when he had become abusive and all, he was complaining from the morning of headache, which was right side in the afternoon. And after late afternoon, he presented with all these symptoms. He was brought in the evening to our OPD. Now, when he was brought out in the evening, on examination, normally we clinically examine the patient, his blood pressure was 100/60. His pulse was 56 per minute. And his random sugar was 256. So we can show that the sugar levels were high that time. So these were the presenting complaints. It is an acute case. Now, what to do? This is question in the mind. I will give you only 1 minute. Everyone can think in their mind. If comfortable, you can put in the chat box, and I will also tell you the answer, what to do, how to approach such case. Acute cases come to us. Okay, in our mind, there are lot many thoughts must have crowded last 30 seconds. That should we give him this remedy? We should give that remedy. Should we ask this? Should we not ask this? Whether we should see his chilly or whether he's hot. All things must have crowded. But in acute friends, there is very less time. Patients are brought to us and we have to treat them and we have to show the results also. So I will tell you now what to do and how I approach the case. Your approach probably may be different. How to approach the case? Now, clinically, I saw patient sounded abusive. So initially he was very well, but he started giving bad words or abusive words. His BP pulse were on the lower side. If you see the normal values of the BP and pulse, it was on the lower side, and the sugars were high. So what was my decision? I will tell you. I decided best is to admit him. Now admit him. The relatives were not ready. They said, "Sir, you give some medicines and we will go home and tell you in 24 hours." But I suggested him to admit. Now, why I suggested to admit, I will explain you. It is acute on chronic phenomena. The patient was chronically having diagnosed to be dementia, clinically we can say. Now, this is an acute episode for this patient. 78 years old man. Probably he would have landed up in stroke, and that would have been a life-threatening event that came to my mind because of this sudden change in the behavior. So I decided to get admitted to a nearby hospital. And also because if some things happen, if we all the time only take symptoms and signs and we make a pairing of them and match the following, if we do and we forget these things, we may land up into medical legal problems also. And the problem was delay in shifting him to a hospital, so this problem would have troubled me. So I took a decision to admit him, and after 2 days of settlement we started the homeopathic treatment. So in acute cases we should keep in mind whether the case has to be done acutely or in brain conditions they have to be admitted. Never hesitate to admit or never hesitate to refer somebody. Many homeopaths are reluctant in referring the patients, but all the time match the following materia medica versus the symptoms is not going to work at all. We have to think from all directions of for the patient's best of his for the best of his life. Now I did a repatriation after 2 days. Now this is a repatriation chart which I will show you. What was there? Anger, sudden and paroxysmal. They told us suddenly he has become angry, he's giving abusive words. And a symptom they told me in the evening that he's feeling little bit, the fan air and this thing is little bit, he's not tolerating that. So a rubric which I took was chilliness in the evening. Anger sudden was one of the rubric. The forgetfulness of the words, that also rubric I considered from complete repertory, but it was slowly, gradually 2 3 months going on. It was not an acute episode. Weakness of memory, that means he could not call his son's name. He could not say that water is, this is called water. So this was a symptom. So we took memory weakness off. Clinically, considering these symptoms, like he could not spell proper words, he could not recall, I took it as apoplexy, recent origin, and stroke. Apoplexy, we know the word meaning of apoplexy related to the blood vessels. So like vascular dementia will be the sequel of this case, I know it. And so I took a rubric related to blood vessels as stroke apoplexy. And stroke congestive, because in congestive you get headaches, and they said that he has got a mild headache also which began before all these complaints. So these symptoms I had taken. The repatriation chart, it showed me that it was belladonna, hyper and barataka. Now this, our final quote is our materia medica. We have to compare these drugs and we have to decide what to give. Now follow up I will tell you. Even after a hospitalization, when I visited him, his mind abusiveness and inability to speak continued. He got stable after admission, but abusiveness was there. They did not have any medicine, they were just irritating him, and he could not speak also. So we started from the repatriation table. We saw here the first leading remedy with vascular pathologies and sudden onset, the pace of the disease, belladonna was indicated. So I started him with belladonna for from the second day, and slowly after 3 to 5 days, his abusiveness reduced down, and even becoming cranky or irritability also came down. So it took around 5 days. The conventional treatment was going on for his life-saving events. After 5 days, his spoken words were better. He recognized things, and the lab parameters also were stable, by which was made by the hospital doctors. So the credit goes to them for stabilizing the laboratory parameters. Now, what is the diagnosis of this case? My homeopathic diagnosis was belladonna, but what is the conventional diagnosis? They diagnosed him after MRI scan as a hemorrhagic stroke in evolution. This is very important. The If I would have not admitted him, his vital parameters, TPRBP would have gone down at home, and he would have probably had epilepsy and died in the house only. So it was a good decision to admit him. Now, what was achieved that we should know? See, because of the admission, we saved the patient from epileptic attacks. Because of admission, he did not have the epileptic attacks. Also, we saved him from becoming permanently disabled due to hemiplegia, because it was a hemorrhage in the brain. So one side would have gone, but we saved him. So that is a good thing. Proper care about his vitals, temperature, pulse were also taken by the hospital people. And also, friends, here we saved ourselves from medical legal problem for not referring the patient in time. Because if the patient gets disabled, they call it this golden hours, 4 hours. If you don't admit them, they have suffer from permanent disability, and we are sued in the court for that. So we saved ourselves also. So all these things were achieved. Now follow up after 5 days. Now after 5 days means administering belladonna. Now we had started the patient means 2 days back. I had started him with arnica TDS for another 1 week, and I will assess him in next week now. A question will come to your mind. Now, Belladonna was given why arnica? He did not have head injury. He did not have a fall. Why arnica? So, friends, we should diagnose the case and we should go on pathological basis. Also, this was my approach for this case. So, arnica has got an absorbent action of the blood, which has accumulated in the brain, and the hemorrhagic stroke was there mild. So, the hemorrhage has to be absorbed. I don't know about conventional medicines, but our medicines absorb the hemorrhage. And because of this absorption, the peripheral edema on the brain also comes out because the brain space has been occupied by the blood. So for this, arnica was given. And why arnica was given? Arnica is mentioned under absorbent action in Pathak's repertory, page number 9. You can refer it. On page number 9, it has got an excellent absorption action. No need that every time everyone should fall down, but excellent action on the vasculature, and I have seen it absorbs hematomas also in cases. So I started up with arnica. Now let us wait and watch in the next week how is the follow-up. So now friends, I'll go to the last part, that is 5 minutes. Take home messages for you in dementia patients. See, all patients are going to come to us, some acute, some chronic, some acute on chronic, and some long. So never assure the patient for dementia that it is going to be curable with homeopathy. You can say that symptoms can be reduced. Do not treat the cases without knowing the cause of dementia. The cause should be known, whether it is dementia is because of this disease and this problem. Refer in time whenever it is required. Never hesitate that. Do not over medicate with mother tinctures for chronic patients. And also here said market preparations and the combinations which are available. And lastly, I would like to say, friends, apply your knowledge of clinical medicine, organon of medicine, materia medica to manage such cases. So this will be a take-home message for you. So I thank you all. I thank you, Dr. Dhanesh sir and IFPH for giving me this opportunity. If any questions are there, I am open for it. Thank you, sir.
Thank you, Dr. Indraneel Bawadekar. It's really an excellent session. You really show the beauty of homeopathy presentation in this forum, because dementia is a big subject, and how homeopathic doctor can achieve the knowledge on this particular subject, and how one can proceed into the treatment, and how one can find out the symptoms, and then not only finding out the symptom, how one can use different repertory for getting the right remedy, and when you get the right remedy, how one can confirm it whether it is the right remedy. And this is absolutely 100% a perfect presentation from you. Congratulations. And it's the time for discussion, and those who want to participate in the discussion can raise your hand. I think Dr. Manoj is always there to begin the session.
Yeah.
Thank
Yes,
you,
sir.
Dr. Dhanesh and Dr. Indraneel. Definitely,
Thank you,
it's a nice presentation, and you are very proficient in presentation. That's the most important thing, most remarkable thing. Even though there are a lot of persons who are very much capable of treating cases, but they may not be able to present in public these platforms. You have done a wonderful thing. Then all over, you have moreover, you are qualified in forensic medicine. I think it's a diploma in forensic medicine. So definitely, that type of courses will further enhance the potential of our brain to explore.
Yeah.
I think
it helps a lot.
our Boniasan is a qualified in forensic medicine.
Yeah.
Yes. So
Yeah.
why that may be the reason this quiz could seven type of analysis done by Dr. Boniasan. So always, yes, definitely. So that kind of skill will be developed in homeopathy case patients, physicians, especially when you are then more than that, you're also qualified in LLB, law.
Yeah.
That's not the kid. Definitely all these things together, because to practice in court. Yeah, definitely you need the proficiency in language. You achieved all those things. So
Thank you,
really
sir. Thank
a
you.
great jump for homeopathy. Thank you.
Thank you, sir. Thank you.
And now I invite Dr. Serbi from Turkey to say a few words on the presentation.
I thank you so much. It is wonderful session again. And dementia is a very important and daily, currently, our patients, and it's very difficult at the same time. And I have some patients, and I know that it is very, very useful remedy. You said that. And for example, conium is very important we must think that. And mercury, the syphilitic dementia problems is very important at the same time in Turkey. And thank you so much. And IFPH, Manoj, and Nanesh, and Dr. Bawadekar, thank you so much.
Yes, Dr. Savgi, what is your prospects in Canada now? Homeopathy, and you are there. We are eager to hear from you. Yeah.
Yeah, it's the last 3 months I'm not here and I didn't listen to you, but I control my WhatsApp, and later I listen, and I will listen to you again, and I will be here. Thank you so much. Later see you, and maybe one day I will come to Kerala, and maybe you will come to Turkey.
Okay, very good, very good. You are always welcome to Kerala.
I hope.
God's own
Yeah.
memory.
Yes. Now I think Dr. Ramprasad want to say a few words. Please unmute.
Thank you, Dr. Thaneji and Manojji, and congratulations, Dr. Indraneel sir.
Thank
Very nice presentation, case, beautiful case, dementia case, elect remedy belladonna, very good remedy belladonna. Belladonna is a bird. It's called other name of bird. B से burning, I से inflammation, R से red, and D से delirium. It's called full belladonna. It's called
nice.
full belladonna. So dementia management of dementia, emotional and individual symptoms, constitutional symptom. After treat the dementia case, and due to injury, brain injury, dementia. Brain injury is the natrum phos is the good remedy. Natrum phos is the good remedy.
Okay, sir.
Arnica, first case, arnica is a very good remedy, and natrum phos, loss of memory, due to injury after loss of memory, natrum phos is the good. Thank you.
Very nice. Thank you, sir. Thank
Thank
you, sir.
Sir,
If
is it
anyone-
is it natural self or natural force?
Natural self, it is
Natrum
natural
self.
That
No,
was
no,
my-
no. Natrum phos, asmiti,
Yes.
loss of asmiti, natrum phos. Natrum self, due to expel the blood, internal to external, urinary and blood circulation, clotted blood. Natrum, function of natrum self. And natrum phos, injury after loss of memory.
Okay.
Okay, sir. It is new learning for us. Thank you, sir.
Okay. Anyway, the subject was really interesting, and we homeopaths, most of us get some kind of at least one case in 3 to 6 months in this kind of dementia. But unfortunately, people are not aware about all these things. So it is high time to bring this thing to the public notice. So then only they will be able to utilize the scope of homeopathy in dementia and all kind of psychiatric problems. As we all know, I still remember a case where a patient was doing so many bad things in front of his daughters. All the daughters were married and they were living in different situations. But this man is talking in a different way. But nobody could understand it is due to this dementia.
Dementia.
But he is always staying naked and talking ugly words and always. But they couldn't differentiate. They took him to a allopathic world and they give a lot of medicine. But still, the patient is doing more. He is unable to sleep and he is sleeping in a different way because of this medication. And when the patient was brought to me, I found that it is because of this dementia that is the reason why this patient is behaving like this. And exactly as Dr. Neelam pointed out, it is the isomers was the remedy given. Isomers 10 works beautifully, and this
Oh.
patient got a relief, and later he realized that he is doing all these things during at the time of disease. When some of his grandchild used to ask the question, why, grandpa, you were doing this thing? Then he was not
Okay.
aware about what he was doing or what he
Okay.
was talking. That was the condition. But anyway, he has a very good improvement after taking this medicine.
Great.
So,
Great.
so that's what I would like to add to this session. So,
Yeah.
anyway, it's a very, very interesting and very, very fine presentation in this evening.
Thank you, sir. Yeah. Yeah. Thank
I am inviting Dr. Sabi to say what of thanks to the session also. Please unmute.
Yeah. Thank you so much. And it is very, really incredible session because the mash is important every time. And maybe Helleborus and
Yeah. Yeah.
Iasiomus, maybe we think that this remedy is. And I want to learn acute memory loss. Please explain that if you possible.
Yeah, yeah. In a 1 minute, I'll tell you. Actually, in a homeopathy, anacardium is the remedy for that. Many times, acute memory loss is having many reasons. It can be an acute stroke in evolution, acute hemorrhagic or thrombotic stroke that can be the cause. Many a times, like because of hyponatremia, clinically it is seen. I've seen in renal failure patients that is there. But the remedy stands out from symptom similarity is anacardium. It works like anything and wonderfully it works. And acute means I will say you, suppose I am talking to you, many times we see in our old age people, even in big meetings, politicians, they forget what they were talking. They said, yaar, main kya bol raha tha? Okay, I'll start from there. So that is acute memory loss. So we can correlate in this way. And anacardium works very well for such patients.
Thank you so much. Thank you, IFPH. Really, really, everything, every evening, we learn a lot of things. And you are encourage all of the homeopathic the colleagues. And thank you so much.
Thank you, madam. Thank you. Yeah. Thanks for your compliments.
Thank you, Dr. Sarbi, Dr. Indraneel Bawadekar, and those
Thank you,
who had
sir.
session in this evening. And really, this kind of presentations will boost, will definitely boost the confidence of all the participants, and definitely it will be beneficial to the public also. And tomorrow we will have a session from Dr. Mashood. He is a retired medical officer from ICE department, and will be presenting Dr. Mashood's a series of experiments with the homeopathic and plant, because he is a person who is doing a lot of research on the action of homeopathic medicine on plants, and he has written 2 books also. And all these books are very brilliant one. He has made some presentation in our local language session, and we'll be talking on his experiments with the plants tomorrow. So hope all of you will be joining us on tomorrow at the same time. With that, we come to the end of the day, 1744. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.